Greetings, everyone, and welcome. My name is Kimberly Hanna. I am a student at SAS Polytech in the Nursing Bridge program. Today, my presentation is about a patient with a psychobiological disorder, specifically schizophrenia. So what is schizophrenia? According to Varkarelis, it is defined as a complex spectrum disorder that affects a person's thinking, language, emotions, social behavior, and ability to perceive reality accurately. It is characterized by psychosis, which includes altered cognition, altered perception, and impaired ability to determine what is or is not real. There are several contributing factors that predispose a person to schizophrenia. First is biological, with genetics alone accounting for about 80% of the risk, especially when a person has a close family member with schizophrenia. Neurobiological factors of abnormalities within the brain's neurotransmitters, mainly dopamine, glutamate, and gamma-aminobutyric acid, GABA. There are also brain structure abnormalities noted on computed tomography, or CT, and magnetic resonance imaging, or MRI. Some potential factors believed to have caused these abnormalities is that there may have been errors in neurodevelopment, inflammation, or a lack of appropriate neural pruning. A second predisposing factor are prenatal stressors, as when the fetus is exposed to viral infection, poor nutrition, hypoxia, diminished neural development, and toxins. Third are psychological stressors, such as elevated cortisol levels, childhood sexual abuse, trauma, as well as epigenetic changes that have been passed down from trauma of a parent or a grandparent. And finally, there are environmental stressors, such as toxins, drug use, social adversity, like poverty, urban living, and high crime environments. As one can see, many of these predisposing factors can occur simultaneously or even overlap. This MRI image of a set of twins' brains shows a vast difference between the healthy twin's brain and that of their twin with schizophrenia. These differences are noted more and more as the disorder progresses or when left untreated. As mentioned previously, biological factors predispose a person to schizophrenia, with one such factor being due to abnormalities in brain structure. These widespread effects in numerous areas of the brain are noted in the following: reduced volume in the right anterior insula, reduced volume and changes in the shape of the hippocampus, decline in cortical thickness, and gray matter deficits in the dorsolateral prefrontal cortex, thalamus, anterior cingulate cortex, frontotemporal, thalamocortical, and subcortical limbic circuits. Reduced connectivity among various brain regions, neuronal overgrowth in some areas due to inflammation and inadequate neural pruning, and widespread white matter abnormalities. One of the main neurotransmitters affected by schizophrenia is dopamine. Dopamine has pathways originating in the limbic system that travel throughout the brain. It is a part of a person's reward system and pleasure center. There is evidence that there is excessive dopamine signaling in schizophrenia. There are also hypotheses regarding schizophrenia's effects on glutamate, as this neurotransmitter works synergistically with dopamine and serotonin in neurotransmission, and therefore may play a role in psychosis. GABA is also impaired in schizophrenia. Let's meet James, a 19-year-old male who identifies as male with preferred pronouns of he and him. He is of heterosexual orientation. His culture is of European descent. He lives in Regina, Saskatchewan with his parents and has been newly diagnosed with schizophrenia. He has a comorbidity of alcohol use disorder and attempts to stop the voices. James has a loving, supportive family and was involved with his local church and basketball league until the acute phase of his illness prevented him from doing so. Having good therapeutic communication skills is important when interacting with James. One example at discharge is that the nurse might ask, "What are 2 things you can do when you are not feeling okay?" This question assesses patient knowledge after teaching has been done. It encourages confidence and autonomy for James to think about how he will respond to worsening symptoms. A second therapeutic question at discharge could be when the nurse asks, "What concerns do you have regarding going home today?" This question allows time for James to explore and voice any concerns about leaving the hospital while feeling heard, understood, and cared for. The first NANDA priority nursing diagnosis chosen is disturbed thought processes related to alterations in neurobiological function, as evidenced by hallucinations and paranoia. A treatment goal for James would be that he will consistently report a decrease in symptoms like hallucinations and paranoia. A nursing intervention appropriate to do with James would be to explore possible actions he can take to minimize anxiety and reduce hallucinations, such as reciting a prayer, singing, or whistling. The evaluation of this nursing intervention would include that the goal is met when James states he is hearing voices less and is using strategies to remain calm and control the voices by reciting a prayer. The nurse would know that the patient is ready for discharge when James no longer hears voices or they have lessened and he has successfully used his strategies of reciting a prayer until voices are controlled or stopped. The second NANDA priority nursing diagnosis chosen is knowledge deficit related to a newly diagnosed disorder, as evidenced by patients stating, "I don't know anything about schizophrenia." The treatment goal by date of discharge would be that James will consistently show and demonstrate understanding about his disorder, such as the disorder process, signs and symptoms, effective use of interventions, as well as medication adherence. One nursing intervention would be to teach James about schizophrenia, such as relapse signs and symptoms, medication adherence, negative effects of alcohol, and interventions to use for relapse prevention. When evaluating the nursing intervention, the nurse would know that the goal is met when James teaches back information taught and demonstrates teaching with successful use of interventions, such as medication adherence and control of voices. The nurse would know that the patient is ready for discharge when James demonstrates understanding of his disorder through verbalizing signs and symptoms to watch for, negative impacts of alcohol, medication adherence, and intervention strategies to control voices. The psychotropic medication that James has been prescribed to go home with is risperidone or Risperdal. Risperdal is an atypical antipsychotic medication that treats both positive and negative symptoms in schizophrenia. It allows James to think clearly and be able to participate in daily activities. This medication should be taken as the physician ordered, in this case 1 tablet by mouth daily, with food or without food, at the same time each day. James must not stop taking this medication before speaking with his doctor. It could bring on a sudden exacerbation of symptoms and a relapse. Risperdal has several potential side effects, including drowsiness, dizziness, lightheadedness, drooling, nausea, weight gain, and tiredness. James should speak with his doctor if these side effects don't lessen or if they worsen after a few weeks of being on the medication. James will also need to schedule routine lab work as his doctor orders to check on blood glucose, cholesterol, and a complete blood count to ensure that there are no detriments to his overall health while taking this medication. The nurse must also teach on things to avoid while taking Risperdal. He should avoid alcohol, illicit drugs, marijuana, stimulants, and certain over-the-counter medications that could cause an adverse reaction, including relapse of symptoms. He should speak with his physician or pharmacist to determine what he can take. Along with the previous teaching, it is vital that the nurse reviews serious side effects, for which James should inform his physician immediately, such as difficulty swallowing, muscle spasms, shaking or tremors, mental or mood changes like anxiety and restlessness, interrupted breathing during sleeping, decreased sexual ability, or enlarging of breasts. James should also seek immediate medical attention or call 911 for severe dizziness, fainting, seizures, painful or prolonged erection lasting 4 hours or more, for an allergic reaction that could include fever, swollen lymph nodes, rash, itching or swelling, especially of the face, tongue, and throat, and any breathing trouble, as well as be aware of a rare condition called neuroleptic malignant syndrome, or NMS, which has symptoms of fever, muscle stiffness, pain, tenderness, or weakness, severe tiredness, severe confusion, sweating, fast or irregular heartbeat, dark urine, and signs of kidney problems, such as a change in the amount of urine. After sharing all of these possible side effects and adverse reactions, the nurse would need to remind James that his physician believes that the benefit of Risperdal for treatment of his disorder outweighs the potential negative effects. Some good local community supports to be shared with James are the Schizophrenia Society of Saskatchewan, the Canadian Mental Health Association, Saskatchewan Division, and the Edgewood Health Network, with their new Willowview Recovery Center located in Lumsden, should he need treatment and support for alcohol misuse. The nurse would also encourage James to reconnect with any supportive family, friends, his church, and social clubs, such as the basketball league that he was involved with before his acute phase of the disorder. Two good crisis intervention resources for James would be the Saskatchewan Health Authority's Healthline 811 and the Mobile Crisis Services, both of which are on call 24/7 and will assist him to get the help he needs in a time of crisis, such as a relapse of symptoms. The nurse would also ensure James has his physician's as well as the Regina General Hospital's contact information. Thank you so much for listening.